Welcome to the Endo Belly Girl podcast. I'm your host, Alyssa Chavez. I'm a nutritional therapy practitioner and restorative wellness practitioner on a mission to change the way that we support women with endometriosis. Endo is a full-body disease that impacts your mind, body, and spirit in countless ways that aren't often addressed the way that women truly deserve. We are here to talk about all of it. Please keep in mind that the content of this show has been created for educational purposes only and should never be used as a replacement for medical diagnosis or treatment. Hey, my friend, and welcome back to the Endo Belly Girl podcast. Today, we are going to be taking a dive into NAC, also known as N-Acetyl Cysteine. Well, that's the full name. Because this is something that I get questions about a lot. It's something that is kind of a buzz supplement, a supplement that there's buzz about, there we go, within the world of endo. So we're going to be unpacking that today and how it can support endometriosis. There was a 2013 study on Italian women with endometriosis that we're going to look at more deeply in a little bit here. But the gist of it was that there were 24 NAC-treated patients in this study who ended up canceling their surgery due to reduced cyst size and pain reduction versus only one of the non-treated patients ended up with that same result. And the cyst size in those patients increased overall. So we're going to take a look at that study and more and how NAC can support endometriosis, what the deal is with all of this, how does it work, is NAC something that you should be taking, does NAC support fertility, does NAC actually shrink cysts, and are there side effects? We're going to unpack all of that today. But first, let's do some myth busting around NAC. So, myth number one, NAC is a standalone treatment for endometriosis. The truth is that endo is so much more complex than that, and we're going to unpack today how NAC can support endo, but always remember that it's important to note that it's not a replacement for diet and lifestyle shifts, right? Endo is one of those things that is just it's complex. There's a lot going on with endometriosis. It is multifactorial, and it's not as simple as take this pill and all of your problems will be solved. So if that's what you're looking for, you might as well exit this episode right now. In fact, just find another podcast altogether, because that's not what this is about. This is not a quick fix kind of deal. It's more of an additional support, as are all supplements, because remember, supplements have the word supplement in it, right? It's meant to be supplemental to a quality diet and lifestyle that is conducive to health with endometriosis or just health in general. So remember that part. Supplements are supplemental. All right, myth number two, NAC is a good option for everyone with endometriosis. The truth, as with everything, there is nuance here and there's bio-individuality to consider. And we're going to take a look at some of those considerations today. Myth number three, NAC doesn't have any side effects. Truth, just like with about any supplement that you can take, it can have potential side effects. So we'll take a look at that today and what that might look like for you and what to watch out for. Okay, so let's start by diving into what you actually need to know about NAC. So I'll start off with digging a little bit deeper into that 2013 study that I mentioned. I have another study more recent from 2023 that we'll look at in a moment, but I'll start with this one because this was kind of the big study that started it all, so to speak. You can still find this easily on the NIH website. That's the National Institute for Health, and that's kind of the primary place where research like this is posted. So if you want to read the details of it, you can definitely check that out. Actually, both of these studies are on that same website. So in that study that I mentioned, there were 92 women with endometriosis. This study was done in Italy, who had endometriosis surgery scheduled in 3 months at the time that this study began. and they all had ovarian endometriomas. Now, some of those women received NAC and some did not. It was a controlled study in that fashion. After 3 months, the results were that NAC-treated patients had overall reduction of endometrioma size, and non-treated patients had overall significant growth in endometrioma size during that time. During that NAC treatment, for the women who had the treatment, they had more cysts that were reduced, and they had fewer cysts that increased in size. And 24 of those NAC-treated patients ended up canceling their surgery because they had improvement in their pain, reduction in the cysts. One of them actually even got pregnant during that time, and only one of the non-treated patients ended up canceling their surgery. There also, over a length of time, were 8 pregnancies that occurred in the NAC-treated patients and only 6 with the non-treated patients. So, some interesting comparisons there. I personally feel like those results tell us something. It's not nothing, right? That's really a relatively big difference in the NAC-treated patients compared to the non-NAC-treated patients. So, I think it warrants looking at. I think it warrants taking into consideration based on those results. Now, there was also a 2023 study in which there were 120 endo patients between age 18 to 45 who were studied and treated with NAC for 3 months. And the results of that study were similar in the sense that the intensity of their period symptoms reduced, their use of NSAIDs was reduced since they didn't have as much pain, the size of endometriomas were reduced, and even the serum levels of CA-125 were significantly reduced. And for those of you who aren't familiar with that, I think that's been mentioned on the podcast before. I know when I interviewed Dr. Sarah Wilson, she was talking about that particular marker. CA-125 is a blood serum marker that is commonly used actually in relation to cancer, but it has been shown to correlate with endometriosis as well. So it's one of the things that they're looking at as something that in the future can potentially be used as a diagnostic tool for endometriosis. I don't know that it's quite there yet, but it is something that some doctors are actually using in practice now. So just an interesting fact. And that's one of the things that they looked at in this particular study. They measured the serum levels of CA-125 before and 3 months into that study, and they did see that levels were significantly reduced. So that's definitely an interesting tidbit there. And also, there were 52 of those 120 patients studied in that 2023 study who desired pregnancy. And of those 52 patients, 39 of them successfully achieved pregnancy within 6 months of the NAC treatment. Now, I will say in looking at this particular study, it looks like all 120 of those patients were taking NAC, so there wasn't a control group, which I don't love. In the world of research, it's always best to see randomized controlled studies in the sense that you want to see both a group that's receiving the treatment and a group that's not receiving the treatment. And ideally, you also want it to be randomized, and even double blind is best, where you don't, neither the patient or the doctor knows who's actually received the NAC until after the study is over. And that wasn't done in actually either of these studies. Neither of these studies fit those full criteria. So I think that's important just to take into consideration. Doesn't necessarily mean the results are completely void or inaccurate, but I just think it's important to note that, because I can't tell you how often I see things where results from research are presented, but then when you look at it, it's like, well, but wait a minute, was that actually... you're kind of just picking and choosing the results that you want to see from that, and you're not really doing your due diligence as a researcher. No, I am not a scientific researcher myself, but this is the best research that we seem to have out there on NAC at the present moment. Personally, I still think it shows positive effects happening. I mean, For me, it's enough to where I do use and recommend NAC within my practice. I've used it on myself, but I just want to kind of put it out there with that disclaimer that maybe it's not everything. I said that from the get-go anyway, that we know we don't want to put all our eggs in one basket, so to speak. And again, it's still a supplement. It's intended to be supplemental, but I do think that these are intriguing results, and there were quite a few of those patients who saw positive results. So I think that that's something to look at. So general conclusions from these studies seem to show that NAC appears to be effective against endo growth and symptoms and have positive effects on fertility outcomes. So that is exciting prospects out there, right? So what does that mean for us? Is that a green light of, oh, well, everybody should just take endometriosis. Everyone should take NAC now if you have endometriosis. Well, there may be more to the picture, and you all know that I'm a fan of informed consent, of really knowing what you're getting into, knowing all the things before you make a decision, because I can't tell you how many people I see who just take all the supplement recommendations that are made to them within a Facebook group and just go with that and don't really have an understanding of what the supplements are, and I think that can be kind of dangerous. So I just want to make sure before you hit pause on this podcast and just run out there and buy some NAC that you know all the things that you need to know, at least everything that we know about at the present moment that I'll share with you. This is all coming from research. Primarily, this information that I'm sharing with you is coming from that NIH website, so you know it's pretty legit information that's coming your way. So how exactly does NAC work? What does it really do in your body? So NAC is a precursor to L-cysteine, which helps to increase glutathione, which is known as the master antioxidant. So it helps to scavenge free radicals in your body, which can potentially impact endo growth and development. It's also a powerful anti-inflammatory, which is important with endo because endo involves systemic inflammation. And NAC can also support liver health. It's often used with non-alcoholic fatty liver disease, which I think is important to note because liver health is huge when it comes to really everybody. Honestly, I think most people out there can probably use a little liver love these days, even if you don't necessarily have liver disease, just because our livers are so often overburdened with our toxic load that we come in contact with and just life that can have impact on our livers. And our liver health is really important for hormone balance and for just being able to detoxify anything that we do come in contact with. So I think that's important to note. NAC is actually also widely used in the medical community for things like acetaminophen overdose, that would be like Tylenol overdose, and in respiratory diseases to help to break up mucus. So it has uses kind of in the wider world of things. It is commonly seen as being safe and well tolerated. So most people who take NAC don't experience a lot of side effects with it, but like anything, it doesn't mean that it comes completely side effect free. I don't know that there's really anything you can take that's going to be completely just take it, you'll be fine, because our bodies are just all unique and different, and we need to take that into consideration and see how your unique body is responding to this, right? Because just because something works really well for one body doesn't mean it's going to work amazingly well for every other body. We have to consider that. So although NAC is typically safe and well tolerated for people, sometimes it can come with some side effects, and that's typically going to look like GI symptoms. Nausea and vomiting is probably one of the most common side effects of NAC, and it can also possibly be skin reactions, like some itchiness or something like that can also be a side effect. So just keep an eye out for that stuff and note any changes in your body as you're taking NAC. I think it's important to be aware of too, because I know more and more people out there are on some sort of prescription medication or another. And there are certain drug reactions that drug interactions that you should be aware of. So there are certain drugs that taking NAC can reduce the excretion of certain drugs. So that's important to be aware of because, you want your liver to be able to process certain drugs as you're taking them, or any drugs as you're taking them. And also that the efficacy of NAC may also be reduced with certain drugs. I'm not going to list out all the drugs here because those kinds of things may change over time in just like what is shown to be impacted. And also, I think it's just an important thing to check with your doctor on. So if you are on medications, you can certainly even just do a quick little Google search of just look up NAC interaction with fill in the blank drug that you're on. But I think it's also important just to, anytime that you're on medication and you're going to add in some sort of supplement or another, I think it's important to just double check that stuff with your doctor because it's not uncommon that there can be certain interactions that you want to be aware of. I know in my practice when I'm working with clients one-on-one, that's something I always ask about up front is if they're on any sort of medications, what medications they're on. And I actually use an online drug and nutrient checker basically where I can check any interactions, any contraindications. That's something that I use regularly in my practice just to be safe and make sure I'm crossing all the T's and dotting the I's. But it's always good just to cross-check, double-check with your doctor as well. I'm always a big believer of just making sure everybody knows what's going on, keeping communication open, and making sure everybody's on the same page because I think that just helps you to have the best experience possible. All right, so if you have been listening to this episode and are thinking that you may want to give NAC a try yourself and see how it can help and support your own body, here's a few little tidbits on how to apply this information to you and your body. So again, if you're going to try NAC, number one, just go and double check it with your doctor, make sure everything is good on that end. And again, remember that this is not a standalone solution for endometriosis. So just because I'm doing an episode on NAC doesn't mean it is an end-all be-all solution, but it can be a piece of the puzzle along with the diet and lifestyle stuff. I'm all about diet and lifestyle first, and then anything else is additional to that. Supplements or anything else that you're going to do, I think really needs to be secondary to the diet and lifestyle stuff. I have tons of previous episodes all about diet and lifestyle. In fact, that's really been the primary focus of this podcast. There's really only been a handful of episodes on supplements. So go back if you're new to the podcast and haven't listened a lot before and you really don't know where to begin when it comes to diet and lifestyle stuff. Definitely go back and listen to some of the old episodes. It would be tricky for me to even list them out here because there's a lot. But if you want to learn about that stuff and don't really know where to begin, do this. Just shoot me a message on Instagram at EndoBellyGirl and just say, hey, you know what? I really want to dive into some diet and lifestyle stuff. What would be some good episodes to start with? And, kind of based on what's going on with you, where you are in your journey, I can definitely recommend some good episodes to start with. I'm always happy to help with that for anybody, because I know at this point in time, this episode, I believe, is now going to be episode 60. That's up there. That's 60 episodes to listen to. That's not something you can take on overnight. I can't believe how quickly these episodes are piling up. So if you just need kind of a roadmap of where to start, I am always happy to help with that. All right. I also recommend with NAC, I know dosage is going to be a question that comes up. I always recommend to start slow and go from there. So the typical recommended dosage is going to be somewhere between 600 to 1200 milligrams per day. And I just recommend starting on the low end of that, right? It's fairly easy, I feel like, to find a supplemental NAC that comes, 500 or 600 milligrams in a capsule. So if you have that, you're just going to start with one capsule a day and just gauge how your body reacts. notice any side effects, any symptoms, just so you can kind of keep an eye on that. And then if all is well, then you can build up the dosage if you need. I also definitely recommend considering the quality of your supplements. This is really important to know. I did a training with Kate Mahoney a while back, who I actually interviewed on the podcast in episode, let me scroll back and see if I can find this really quick because I hadn't actually planned to share this episode until right now. There we go. Episode 36, Supplements with Kate Mahoney. I interviewed her. She is just a wonderful resource when it comes to all things supplements. And one thing that she says frequently is that there really are only 15% of supplements out there that are worth taking. And most of them are not going to be found, unfortunately, on the grocery store shelf. I think that's just an important thing to know. Also, don't buy supplements on Amazon. Don't do it because there's no quality control. You don't know what you're getting. Many times the supplements don't even come from the manufacturer. It's very easy for people to fake it, what would be the word? I can't think of the word right now when you're counterfeit. There we go. Counterfeit supplements. It's a thing. People will try to sell you supplements that don't even have any value to you, which is sad. I'm sad that happens, but it does. So be careful where you're buying supplements. Honestly, my best recommendation is just to consider working with a knowledgeable practitioner who understands supplements and knows supplements. You know, I do take on clients myself. If you are looking for that, you can book a free consultation with me. That link is always available in the show notes. So yeah, that's my best recommendation, which I know is not like a full and complete answer, but it's a little more complex than that just because many of the supplements that I recommend to my clients aren't actually just available for anybody to purchase. They have to be purchased through a nutrition professional who has training in that area. So that's why I'm not recommending any particular brand, just because I'm not sure what is widely available to everybody. But that's my caveat there, is just to be aware of sourcing and quality and all of that good stuff. And then as you're taking it, just be aware of your symptoms. Look for any sort of negative reactions. If there are any changes in your bowels, any sort of negative reactions happening, just keep an eye on that. If you're working with a doctor, keep an eye on endometriomas if that is something that is a thing for you. Not everybody with endometriosis has endometriomas, which are also known as chocolate cysts. They're a type of endometriosis growth that typically grows on an ovary. It's often easy to see on imaging like ultrasound. So if that's something you're keeping an eye on, it would definitely be interesting to see any changes in that. So maybe go in and get a little ultrasound done beforehand and then wait a few months and try again and see how things are progressing, just so you can see what sort of impact it has on your body. I think is always important to know and be aware of. And then, of course, just keep an eye on your own personal symptoms. How are things looking with your cycles? How are things looking with your overall inflammation, fatigue, right? How are things going for you? Any changes in your fertility? Keep an eye on those symptoms so you can see how well it's working for your body. Because as always, I am a big believer in bioindividuality. So listening to the signs from your own body above all else, I think, is super important. And just really finding out, is this something that's really working and resonating with you? Or is it something that you're just taking because you heard about it online somewhere, on a Facebook group, on this podcast, and you just started taking it just because it sounded great? I highly recommend give it a try, sure, if that's something that works and resonates with you, but also keep an eye on how things are moving and changing in your own body, because we're all different. We all react differently to things, and I think it's important to keep an eye on that and see what really is working well for your body. All right, my friend, have a great rest of your day. Much love, and we'll talk soon. Thank you so much for joining me today, my friend. If you loved what you heard, be sure to share with a friend and subscribe so that you can keep coming back for more. If you are ready to take the next step towards getting to the root cause of your endo symptoms like endobelly, pain, fatigue, and so much more, you need to download my free ultimate guide to building your own endometriosis diet. You can find the link in the show notes or at www.endobellygirl.com. Until next time, my friend.